So that moment where you learn that you have HIV and you're about to start treatment is one of the worst moments I can imagine in someone's life. But the good news is that the medications that you'll take can be tailored to what you need. And so HIV medicines have now become the types of things where if one medicine doesn't work for you, we can find another medicine that will work. So combination antiretroviral therapy is based on the idea that HIV needs to be treated by multiple medications, and antiretrovirals are basically the class of HIV medications that we use that target this virus. And there's several classes within that. Basically, each of those classes of medications targets the HIV virus in a different place. So some of them target HIV when it tries to enter the cell. Some of them break up HIV's ability to replicate its genome. The idea with using lots of different ways to target HIV is because HIV is unfortunately a very strong virus. And what the virus will do is that if you only use one medication on HIV, it will learn the medicine that you're using and it will mutate. So that one medicine that you try to use will no longer work. This is why you'll often hear your doctor talk about 3 classes of medicines that are being used, because we have to make sure that we're targeting HIV in kind of all the different ways. The physician will decide with you about the antiretrovirals to take for your HIV. We factor in several important characteristics for the patient. So one of them is if you're a woman of childbearing age, there are certain HIV medications that we shouldn't give you. If you are someone who has another chronic condition, like if you have epilepsy or if you're taking medication for bipolar disease, those medications can sometimes interfere with your HIV medicines. Some people have certain side effects that they have with certain medications. And then cost is something to factor in for some patients. Luckily, in many states and in most places, your insurance will cover the most effective and safest HIV medicine for you. But if for some reason that isn't the case, we can always find a medicine that is affordable that can be on long term.